Now I'm gonna leave this image on for a little bit. So my mum was calling with this lady. Obviously we were bored, so she just took funny pictures and that. Because why not, eh? What is there any better to do? Yeah, she just went on call with people. Like anyone that she knew, she just had to call. She got took off work as well, so, and she worked for the NHS as well. Both of those two on the screen, so give them a clap. They are very good at helping out the country. Just a huge clap to the NHS, by the way. Like, huge clap with the coronavirus going on. Here is Robert doing his daily things, sat on his ass, drinking his beer. As you see here in a minute, this is what's driving him insane. Look, he's doing weird poses. It's insane. Like, it's just driving us insane. Please, quarantine! Help! Like, man! So, guys, this is the coronavirus. It may not look harmful, but trust me, those big brain cells that are in your head, the disease is bigger than that. Now, it is worldwide. It's a pandemic disease. Now, it is just like the swine flu, but it's come back ever slightly stronger than the swine flu. Now, because it's come back stronger than ever, we are having to take measures that we don't want to take. The government is having a really hard time dealing with this because Spain's all got it and that, so I mean, we can't really do it about it until it really finishes. And I mean, when it finishes, we don't know, but news are going to say that it's going to come back in the winter, and if it does, well, you've got another extra 5 months to wait. So, here today is the government discussing about the coronavirus. So the symptoms is actually really easy to spot out. If you don't do the steps like Boris Johnson actually made the law to wash your hands and that. Guess what? He didn't do it himself. He's got coronavirus, like everyone. Basically, half of the earth is very vulnerable. Not actually very vulnerable. It's actually the people on the earth, because the earth is really big. So, you're asking yourself, how can the coronavirus get all around the earth? Now, so where I live, what I'm thinking is someone has come from Spain, and because of Spain, for like the second place the coronavirus infected was Spain. So some people hopped off a plane from Spain into the UK, into, for example, any airport. They came into the airport, and when they were about to get off, they checked those people if they had the coronavirus, and they did. So you're asking, how can it spread? Well, that. So if other people have it and then go to, for example, the UK, and they don't even know they have it, they're spreading it to other people, even if they don't, even if they get them in like quarantine or that in time, into asylum or whatever they put them in, they still could have affected other people because they should have been in their house or in their homes because they should not actually be allowed to any place, so back to their country when the pandemic is going on. Because as you see here on the screen, Boris Johnson has been infected with the coronavirus, and for the past 3 or 4 days our numbers have been increasing and increasing, and that is because no one listens to the government. No matter what you say, the government will always try and overpower you, like with their words and that, because they have actually proven that Boris Johnson gave other people the coronavirus and think he could have spreaded it more, because he had all these meetings. He could have spreaded it to other people, like maybe other prime ministers, but not like prime ministers they are now. Maybe the prime ministers that they were in the past. So, and you're thinking, what's going to happen to the royal cabinet? Nothing. Absolutely nothing. Because, well, actually, there might be, because, believe it or not, Boris Johnson was with the Queen when he didn't know he had the coronavirus. So we actually don't know if the Queen has it, because she's been near Boris. So you never even know. Now, if you look on here, there is coronavirus deaths in Wales. And this is very heartbreaking, because think about it, loads of millions of families across the world, their parents or that might have the coronavirus and they don't even know. So just thinking about it is really sad, because like these guys here, they're here, for example, and they're in this place and they're not even 2 feet apart from each other. They are like, actually, if you considered being there, you'd think that's quite close, but it's really, no, you'd think standing there, it looked quite close. But on TV, they look quite far apart, because they've got a wider lens on the camera. So, this pandemic was all because of China. Now, I'm not being racist. I'm saying this because they eat bats, and according to the scientists, bats are what caused coronavirus, which actually means they can't say anything, because they hadn't even found out themselves what the coronavirus can do to your body. Like the side effects that scientists say, always look out for these side effects, but what if you already have those side effects when the coronavirus wasn't a thing?
But the support that we're getting from volunteers, from the armed forces,
now, because you're probably getting a headache from my talking, the government are going to do the talking for a while, and yeah, you just watch and see what the government says. So I'll be quiet. Goodbye.
And it was therefore very gratifying for our staff across the NHS to see this remarkable outpouring in the Clap for Carers last night. For many nurses coming home from a day at hospital, or for other staff returning to start again for the night shift, it will have meant an enormous amount to know that the whole country is behind them. But the best way we can show that support, of course, is actually by doing what it will take to reduce the rate of infection, because even simple actions following this advice will save lives.
Thank you very much, Simon. I'll now turn to the media to take questions. And I think our first question is from Vicky Young of the BBC. Vicky.
Mr. Gove, the Prime Minister has coronavirus. The Health Secretary does as well. The Chief Medical Officer is in isolation. People will be looking at this and maybe wondering whether you haven't been taking your own advice or you maybe acted too slowly when it came to stopping the spread of coronavirus. Another question, please, to Sir Simon Stevens. We've had cancer patients getting in touch with the BBC today, very worried about the cancellation or postponement of their treatment or operations. Many of them worried that their own lives may be being put at risk. And a question for Dr. Harris, if I could. Can you be more precise about the peak of this outbreak?
Well, thank you, Vicky. I'll turn to Simon and to Jenny in a second. I think the fact that both the Prime Minister and the Health Secretary have contracted the virus is a reminder that the virus does not discriminate. We are all at risk, and that is why it is so important that we practice social distancing measures. Those are in place in government. Ministers are working remotely and from home using video conferencing in order to make sure that we can follow the strict advice that all of us should be following in order to help to protect the NHS. Simon.
On the question of cancer care, we've been clear that we do want essential and urgent cancer treatments to continue, but that cancer specialists should have the opportunity with their patients to decide whether it is more risky for somebody to embark on treatment at this particular time, given that you are more vulnerable to infection if you begin a course of treatment, perhaps chemo, or become immunocompromised as a result. So those are clinical decisions that will need to be taken. We've also agreed a landmark deal with all of the independent hospitals across the country, which has given us the ability to look after patients away from the busy hospitals that are treating coronavirus. And in London, for example, the Royal Marsden is therefore coordinating cancer care right across the capital, so that even if patients aren't being looked after at their local hospital, they will be getting the care they need. But these are very difficult and sensitive judgments that need to be made with the full involvement of cancer clinicians as well as patients.
Thank you, Simon. Jenny.
Thank you. Yes, I'm going to be a little bit repetitive. The same question I think was asked yesterday from a different media colleague. It would be very foolish of me, I think, to predict precisely when we expect the peak to be, not least because we have put in social distancing interventions and we are looking to see how well they work. As I said yesterday, there's some early indication that the public are really now heeding that advice, and we thank them for that. It's really important that they continue to do that. We do not expect to see a significant change in our numbers for 2 or 3 weeks, and so we really need people to stick with us and stick to those social distancing interventions for that period. We are, of course, monitoring that data daily, and we will obviously, when we've got a firm prediction, then we'll be happy to share that with you.
Thank you. Thank you, Vicky. I'll now turn to Carl Dillon of ITV.
Thank you, Mr. Gove. Obviously, it's good news that we've heard that the Prime Minister is only experiencing mild symptoms, but I'd like to know, what is the plan should the Prime Minister not be able to continue with his work? And also, given that there does seem to be a limit to the number of tests that can be done, what is the system for testing people like yourselves at the top of government who are dealing with this crisis?
Well, Carl, the Prime Minister has only mild symptoms. He took part in, he chaired a video conference earlier today, and he was able to marshal the resources of the NHS and different government departments, and indeed of the private sector, in order to bring forward the testing initiative that we've announced today. But I'll hand over to Jenny to say a little bit more about the testing protocols that guide the way in which.
Hi folks, I want to bring you up to speed with something that's happening today, which is that I've developed mild symptoms of the coronavirus, that's to say a temperature and a persistent cough. And on the advice of the Chief Medical Officer, I've taken a test that has come out positive. So I am working from home, I'm self-isolating, and that's entirely the right thing to do.
And there you go, ladies and gentlemen, he said it in his own words, tested positive for coronavirus, and he was pretty vulnerable to it in the first place because he was hanging out and having meetings, so I mean, he's possibly as well. Now sit back and relax and watch the credits.